Welcome back. This is the Dentist News Network. I'm Scott Drake with my guest, Dr. Brian Harris with Harris Dental in Phoenix, Arizona. Dr. Harris, welcome back.
Thank you.
Much information in the news these days is about the correlation between the health of the mouth and the overall health of the body. Can you talk a little bit about that?
Yeah, you can. It's actually a big paradigm shift right now that's happening within our profession. In the past, dentists were looked at as just the guys that fix things. We fix problems. But as research has shown and as more studies have come out, people are realizing there's such a big connection between the health of the mouth and the health of the body, whether it be incidents of stroke, heart attack, birth defects, erectile dysfunction. There's a lot of different things that can happen to the body because of what's going on in the mouth. And if you think about it, everything happens through the mouth. We eat with it, we talk with it, we breathe through it. Everything that comes into this body of ours really comes in through the mouth. And so all the bacteria in there, all the different diseases that happen within the body can definitely be affected by what's happening in the mouth and the environment that we've created there.
Would you say that in some cases, when you look into someone's mouth, it can be used sort of as a diagnostic tool?
Definitely, and we see that a lot. We're in the habit now of doing oral cancer screenings on every new patient that walks in the door, and our current patients also. We feel that it's our responsibility and our job to check these patients. They're going to see us at least a couple times a year, where they may not see their regular MD or their regular doctor for 2-3 years at a time. And so we feel the responsibility to go in and check for these things like oral cancer, head and neck cancer, other systemic diseases that will manifest in the mouth. It's a big responsibility that's been put on our shoulders as health practitioners and as dentists, but it's becoming the standard of care for what we do.
Dr. Harris, studies now show that there is a direct link between the HPV virus and oral cancer. The HPV virus affects a wide age group. How does that affect your oral cancer screenings?
Yes, it has. So now there's multiple ways that we can screen for cancer. We can do the traditional head, neck, what we call palpation, or it's the touching, the feeling, the looking for anything that's abnormal. There's also a blue dye that you can rinse with, and you can shine a light on it to see any signs of cancer. And there's also a brush biopsy test. Now there's 5 or 6 different separate ways that we can test for these things, and it's better to be safe than sorry. That's what I always tell my patients as they come in. If I do see something suspicious, it's worth getting it looked at. It's worth taking the time to look a little bit deeper into things, because as we know, cancers of the mouth and squamous cell carcinoma and some of these cancers are very aggressive and happen very quickly. So we need to act quickly on our part also.
Gum disease and periodontal disease is really all about inflammation. Can you talk about how that relates to the rest of the body?
I can. In fact, in the last several years, one of the big changes in dentistry and in medicine is the correlation between mouth inflammation and systemic diseases. If we get an infected fingernail, or if we get an infection on our body that swells, that bleeds, it concerns us. We'll go to the doctor, we'll take antibiotics, we'll do a lot of different things to get that pain or that swelling to go away. However, if we have daily constant bleeding, constant inflammation in the gums, it's a lot easier to ignore, and we don't really look at it as the same type of problem, but essentially it is. It's inflammation, it's bleeding. Things get inflamed for a reason. The body is trying to tell us that something's not right here. So that's been the big shift recently in gum disease and dentistry and how we treat that. In the past, it was just scaling and scraping and cleaning off those teeth and hoping that it gets better. And that method is actually really effective. It's just a little bit more uncomfortable. Nowadays, we're doing a lot of actual DNA bacterial testing, where we can run a culture of the mouth, find out the specific bacteria that are in there, and then target them specifically, whether it be through antibiotics or local antibiotics, and help cure and treat the infection instead of just watching it and hoping that it gets better. So that's a big change that's happening, and dentistry and dental health is really how we're approaching these diseases and how we're treating them effectively.
And finally, have you been able to see a direct link between, say, curing gum disease and really improving the health of someone's body overall?
Definitely. And my hygienists come to me daily with different stories of, Dr. Brian, you wouldn't believe this guy, look at these pictures, look where he started, look where he is now. And, so many things that come along with the gum disease and periodontal disease, whether it be bad breath, whether it be bleeding, infection, sore gums and teeth. When we get that under control and we can find that balance point, and we get the body's bacteria and the bacteria in the mouth balanced to a healthy, stable point, you feel it. You feel it in your mouth, you feel it in your body, you just feel more healthy.
Thank you, Dr. Harris.
Thank you.
My guest has been Dr. Brian Harris with Harris Dental in Phoenix, Arizona, and you're watching the Dentist News Network.